How's your health? Hey, this is Dr. Randall here with another one of my Friday videos, and I want to talk about a pretty important topic, which is your health. And health is a tricky, interesting question, but I'm going to focus on metabolic health today because that's sort of the trendy thing we're looking at now, and these 5 indicators are very strong indicators of both current health and the future of your health. And I think it's missing a marker, but I'm not a medical doctor, but I'll explain my rationale when we get to it. But almost every study out there says that the vast majority of us are unhealthy. More than 9 out of 10 people eating a Western diet, living a Western lifestyle, are metabolically unhealthy. 9 out of 10. Almost all of us. So just because we look a certain way, feel a certain way, doesn't mean that we are healthy. And so we often talk about, the obese people, the overweight people, but no. Anyone can be metabolically unhealthy. So here are the current 5 markers we use for judging metabolic health. Blood glucose levels between 70 and 100. You can get this done at your annual physical. You can get an at-home test, prick your finger, stick a thing in the machine, and it tells you that level. A lot of people actually are getting those at-home ones just to monitor their glucose levels, especially after eating. You can see how your blood sugar rises and falls with what you eat. The second one is triglycerides. And these, and along with cholesterol, have gotten, a lot of wrong information. But there's a certain combination we do look at. So triglycerides, we want to be less than 150. That's going to have to be done in a blood test at your annual physical. HDL cholesterol, that's the good stuff, although again, that's a lot of issues going on there. And don't worry so much about cholesterol, especially cholesterol in your food. Anyway, the good HDL cholesterol, you want 40 or above to be metabolically healthy. Blood pressure, you want under 120 over 80. And the above that starts talking about hypertension. That's certainly one of the indicators of metabolically unhealthy. And then waistline. So for men, under 40. For women, under 35. And so waistline does play a role, but it's not the number one indicator. So those 5 things, and most of us have an issue with at least one of those, some multiple. And when it becomes a multiple, it then turns into metabolic syndrome, which then leads to a cascade of chronic illnesses, including cancers, heart disease, stroke. So we want to stop that. But my one issue with these measures is that it misses cognitive marker. Because there was a recent study just came out this week from Tufts University where they did a longitudinal study of people, and they found this crazy result that less than 10% of people who ate a low-quality diet most of their life, and by low quality, we're talking about the standard American diet, the Western diet, less than 10% still maintained their cognitive abilities into their 70s. So this standard American diet, this Western diet, doesn't just affect us physically. There's a gut-brain axis. It affects us mentally, cognitively, and of course there's also mental health issues involved with our diet. So please, let's get better with our metabolic health, with our brain health, by eating better. And you can learn more, and you will be more and more being published over the next several months, but go to healingrevolutiondiet.com. It's not a diet. It's a philosophy. It's a perspective. It's a mindset. But there are some rules. There are 10 principles of it. But let's get on this healing revolution, people. We need to do better with our food, with our bodies, with our minds, and with our hearts. All right, this is Dr. Randall wishing you a great day ahead and a wonderful, wonderful weekend. Get out in nature.